Bismillahirrahmanirrahim. The topic of our today's presentation is types of research design. In the previous lectures, we talked about the research design. What is the importance of it? It's the layout or blueprint based upon which your whole research it depends and it decides to plan your study accordingly. And there are different types of the research design and based upon different perspectives. Today we'll be talking about the research design on the basis of number of contacts. Like previously we talked that there are three perspectives on which mostly the research designs they are constructed. For example, the first perspective is number of the contacts with the study population, the reference period of the study, and nature of investigation. Today we'll be talking about the study design that is based on number of contacts with the participants. Based upon number of contacts with the study population, research design can be classified into three groups. Number one is a cross-sectional study. Number two, a before and after studies. And number three is the longitudinal studies. The first one, or the very popular one, most commonly used study design based upon the contacts with the study population or the participant is called as the cross-sectional study design. This study design is also known as a one-shot study design, status study design as well. And this type of design is very much helpful to bring out an overall picture, an overall image of the study that you are of the population that you are going to study at a specific point of time. It is one shot you are going to contact with the study population just only once. And this type of study is best suited to find out the prevalence of a phenomena, situation, problem, issue by taking a cross-section of the population. You are going to just take one cross-section of a population and then you are going to, whether you are going to collect the sample, whether you are going to interview them, you are going to observe them, but it's going to be a cross-section of a population and you are going to get a true picture of the phenomena at a point of time. It is extremely simple in design. You decide what you want to find about, identify the study population, select the sample, contact your respondent or participants, find out the required information. That's one way. You can you decide what you want to find out, then you identify the study population, then you collect the samples from the study population, and then you're going to note down your findings, observations. That can be another way. And they are all very much helpful in obtaining an overall picture as it stands at the time of the study. The cross-sectional study involves only one contact with the study population. Therefore, they are comparatively cheaper to undertake in comparison to the other study, let's say design, for example, longitudinal, or you can say other like before and after study design. In comparison to them, cross-sectional study designs, they are comparatively cheaper to undertake. The cost of conducting such type of study is a little bit lower than the rest of the study designs, and it is easy to analyze. You don't have got that much complex data. You don't need to compare the data. So it's comparatively easy to analyze as well. And that's their advantage that it's cheaper to undertake, cheaper to conduct such kind of study, and the data that has been obtained from such type of study design, they are comparatively easy to analyze, easy to interpret. However, their biggest disadvantage is that they cannot measure the change. If you are studying a phenomenon, then you can study it on one point of the time, but you cannot measure the change because you are not taking the samples at a different point of time again. Whenever you are measuring a change, you need to have at least minimum 2-point data with you. And this type of study design is most appropriate for following topics. For example, incidence of HIV positive cases in Australia. You just want to look at a specific time point, let's say in 2020, what is the incidence of HIV positive cases over there right now. So that's cross-sectional study design. The impact of unemployment on street crimes, the relationship between home environment and academic performance on a child. What is the relationship? But that you cannot, just that's at one point of time that you are going to study what is the influence of human home environment and the academic performance on a child. What is their relationship? The health needs of a community. You can study under these cross-sectional type of study design. You need to understand that is you are going to contact just once with the community, let's say, and you are going to assess whether you are going to utilize some questionnaire, asking them what are their requirements for the health, and then you are going to conduct that study. That's it. For example, there can be some other in biomedical sciences, let's say you decide a sample population, then at times you expose it to a phenomena, then you look whether this exposure has led to the development of certain disease or cases or not. No cases are reported by the exposure of that phenomena. And then at the same time, you have got a control group, which is a non-exposed group, and then you look at it. Even it's at time not a control, but again a fraction of a population which is not exposed to a phenomenon, and then you look at it whether the cases are developing or not. For example, you decide for a study population like medical practitioners or doctors in an area, and then some of them they are cigarette smokers, that is they are exposed to tobacco, and you look at it whether some of them they have got the cases of lung diseases or cancer, liver or lungs cancers or not, whereas some other might not have. Then again you are going to take a fraction of the population of the fraction of the, just like that, some medical practitioner or doctors who are not utilizing the tobacco, who are not smoking cigarettes, and you test whether they have developed lung disease or cancers, lung cancer or not. So this is how you conduct a cross-sectional study. Another important type of study based upon this the same contact with the study population or participants is the before and after study design. Now, the problem with the cross-sectional study is it is not able to measure the change because you just contact the study population or the participants or you collect the sample just for once. Now that advantage is covered by before and after study design. This is also called as pre-test post-test design, because it is very much this type of study, that is before and after study design, it is helpful in measuring the change in a situation, phenomena, issue or problem or attitude. It is the most appropriate design for measuring the impact or effectiveness of a program or awareness campaign, because you collect the sample, you put up the questionnaires, you let's say observe the study population before a phenomena and after a phenomena. It is very much effective if whether you are launching a campaign, then before campaign what's the status of the population, and after the campaign whether it has done some improvement or it's provided with you with the negative results. The before and after study design, it can be described as two sets of cross-sectional data collection points on the same population. So in this study, you are going to collect two sets of cross-sectional studies or data collection, that is on the same population. From the same population, you are going to collect a data on two different time points in order to find out the change in the phenomena or variable between 2 points in time. The change is measured by comparing the difference in the phenomena or variable before and after the intervention. For example, you induce a disease in a mice model, and then to two groups, you collect the samples before introducing an intervention, let's say a therapeutic, some ingredients, let's say, and you collect the samples before introduction of the that therapeutic intervention and after you have introduced the intervention. So two time point will be taken. Similarly, like let's say you initiate a dengue awareness campaign. So you design some questionnaire. You ask the study population about their knowledge of the dengue, how is it spread, and what are the different measures which can be adopted to decrease the prevalence of the dengue virus in the dengue virus disease in a population. So at first time point that the questionnaire is going to be utilized, then you initiate a campaign, let's say for a period of 6 months or so, where you awareness sessions, workshops, posters, banners, they are going to be displayed. And after 6 months, again, you are going to take the questionnaires, and then you are going to present them to the same population, and then you are going to get an impact that whether this awareness campaign, whether it has educated the population or not, how much they have got by introduction of the campaign. So you're going to compare the difference in the phenomenon. The change is going to be compared at, because you have collected the samples, you have asked the participant at two different time points. So you are able to measure the change in a phenomenon. For example, before and after study design. So before a pre-observation, a data is collected from a study population, then an intervention is introduced, and the study population is again contacted, and again post-observation, and again the data is collected. So time point, there we have got two time points at before a pre-test and collection of sample or data after or post-test. Now, before and after study design is carried out by adopting the same process as a cross-sectional study, except it comprises two cross-sectional data sets, the second being undertaken after a certain period of time. A before and after study may either be an experiment or non-experiment. That depends on your study design, whether just an observational study, a questionnaire-based study, whether it's an proper experimental intervention study. Example of topics that can be studied using the before and after study design, it can include the effect of drug awareness campaign, a program on the knowledge about and use of drug among young people, the impact of increased funding on quality of teaching in the universities. Let's say you observe the universities, you assess them, you look out for their quality before a funding is released, and then you increase the funding, and then again you assess it, whether the quality of teaching has improved or not. The impact of maternal and child health services on the infant mortality rate. What's the impact on infant rate? You have previous data where, let's say, you know the infant mortality rate, and then you are going to introduce maternal and child health services, let's say nutritional supplements to the infants, and then at the second time point in the coming end, where after these interventions they are introduced, their impact is going to be calculated on the infant mortality. What are the advantages and disadvantages of B&A design? The main advantage of a before and after study design is its ability to measure the change in a phenomenon or to assess the impact of an intervention. However, there can be certain disadvantages which includes a two-days data set of the data. It must be collected involving two contacts with the study population. Therefore, the study is comparatively more expensive. Like in the cross-sectional study design, we know that it is based upon collection of data from the study population for once only. It's a one-shot experiment, just only for a single time we are going to collect the data. Therefore that was comparatively cheaper. However, this type of before and after study design, because since it is conducted involving two contacts with the study population, is comparatively expensive, and then it is more difficult to implement as well, because the data that is going to be collected through before and after study design is comparatively, it's complex data. So the study, it requires longer time to complete, and it requires additional biostatistical tools, let's say for biomedical sciences, to complete as well. In some cases, the time lapse between the two contacts may result in attrition or gradual decrease in the study population. Like you have contacted a study population, let's say for one period of time, and after, let's say, 2 years or 10 years or 1 year, you contact them again, then there is the chance that you might notice a gradual decrease in the study population, because let's say some of the study participants, they move out of the, let's say, study area, or they withdraw from the experiment for other reason. For example, Some of the study participants, they are no more because of they are they are dead. So because of the death, so uh, the second time they won't be available for the study to be conducted. Therefore, attrition or gradual decrease it can be resulted. This is the problem with before and after study design. Another problem is if the study population is too young and there is a significant time lapse before the D&A sets of data collection, the changes in study population may be because it is maturing. This is particularly true when you are studying young children. This effect is called as maturation effect. Initially, let's say you collect some data from, let's say, you information, or you collect some data from some youth, very young population, let's say about the drugs, let's say, and then after a course of time, then you again contact the population. Then because it's not because your awareness campaign is affecting, it's because the children, they are growing up, there might be some confounding factors which intervene with your studies, which disturb the studies, and because of that, maturation effect uh, is seen, this effect is observed. So this is another problem with this type of before and after study design. When there is, especially this type of problem arises when there is a significant, very long time lapse between two sets of design. If you decrease the time lapse, let's say you collect a sample from a study of very young children, let's say when they are of age 3, let's say 7 years, and then you collect again the second set of data at when they are aged as, let's say, 8 years, then the time lapse is comparatively short. Like if you take the samples when they are 7 years, and then you again collect the sample when they are 14 years, it's a big time between two data collection time points. So you might observe maturation effect in the study. That's another problem of disadvantage of before and after study design. Now, sometimes the instrument itself educates the respondent. This is known as, another effect is the reactive effect. And suppose you want to assess the impact of drug awareness program, and you design a questionnaire enlisting various drugs and asking respondents to indicate whether they have heard of them, whether they have heard of ICE or any other drug that you name. And the respondents, uh, at a pre-stage, respondents, they might not know the names of the drugs. However, during the course of the studies, you yourself is educating them. So the instrument of the study is indeed educating them, and the post-stage study, their responses can be because of this reactive effect. So that is also another consideration of the before and after study designing, especially in social sciences. This is very much true in social sciences. Another disadvantage is that before and after study is the attitude of assess when we assess the attitude of population towards an issue is a possible shift in attitude between the 2 points of the data collection. Sometimes people, they are placed at the extreme position of a measurement scale at a pre-test stage, and then they feel, the participants of the study feel they are too much negative or too much positive about the phenomena at a pre-test stage. When you have originally, for the first time, you have collected the sample. When you have you have questioned them, you have placed them with the questionnaire, and you have noted down the observation. At that time, they might totally negate, they might totally support your theory, but during the course of the time, they might realize, no, we were too much negative about the phenomena, we were too much positive of the phenomena. When they are at the extreme positions, then during this effect is called as the regression effect. During the course of the second data collection, those same people, they might think, okay, we should be a little bit lenient, we shouldn't be too much extreme towards the, you know, any phenomena. Therefore, sometimes the people, they shift, they change their position of data collection just because of the attitude. So this is another disadvantage, that regression effect is observed during the course of before and after study design. The third type of study design based upon the context with the study population is the longitudinal study design, and it determines the pattern of change in relation to time. Longitudinal design mostly does that, and they are very useful when you need to collect factual information on continuing basis. Uh, for example, when you want to ascertain the trends in demand for labor, or immigration, or changes in the incidence of a disease, or mortality, morbidity, fertility patterns of the population, and you would like to assess that trends on a continuous basis. It's not just one or two times. You can contact the population multiple times. Then that type of study, when you are visiting the population at regular intervals, usually it is spanned over a very long period of time in order to collect the required information. At times, these intervals can be as short as few weeks, or they can be longer than a month, than a year. So, these type of studies, where the study population is contacted time and again to study the pattern and change, is called as the longitudinal study. It can be seen as a series of repetitive cross-sectional studies. For example, uh, if we look at the cross-sectional study design, let's say we have got three different groups, and you just at a single time point you contact these groups, let's say, and for, you are going to collect the one shot information or data collection for that study group. Whereas a longitudinal study design is conducted in a way that you have got just only one study group, and then you are going to conduct them time and again after a regular interval of time, after a regular, let's say, that is pre-decided by you. That can be, let's say, 3, 4 times or 5 times or even 10 times. That depends upon you. So it is a combination of, let's say, cross-sectional studies. The longitudinal study is a combination of cross-sectional, couple of cross-sectional studies. Now, advantages, disadvantages, sorry, of longitudinal study design is the main advantage of a longitudinal study design is that it allows the researchers to measure the pattern of change and to obtain factual information requiring collection on regular basis, thus enhancing its accuracy. When you collect the samples from a, let's say, study participants, whether it's when you collect the information from a study population, whether you observe them over time and again continuously for a comparatively a longer span of time, then you are going to get a very true factual information, and it is comparatively accurate. In contrast, the problem with longitudinal study is the conditioning effect. That is, the problem is if you describe a situation and use the same, you are contacting the same respondents quite frequently, and then they start to know what is expected to them, and then they may respond to the question without thoughts, or they may lose interest in the inquiry with the same results. So this is the problem, especially in social sciences, that when whenever you're collecting in even biological sciences, you're collecting the samples time and again, then there might be uh, this conditioning effect is over there, can be affected because they the respondents, they might observe, they might be deep in their mind, they might be knowing what they are expected to answer, whether so that can lead to certain again confounding factors in the study, and that can be the conditioning effect. And longitudinal study that suffers from the conditional effect, where especially the respondents in sort of observational or the questionnaire study, especially there's respondents, then they know the questions, and then time and again they are contacted with the same questions, then they know what is expected of them, and then they lose interest as well. Thank you so much for listening to this.